You said that you're good friends with Bobby Kennedy, and he's obviously running right now with Donald Trump, and hoping to get Trump back into office so that, the idea is, and of course, there's no guarantees because you got to get through the Senate confirmation hearings and all that bull. But the idea being that Bobby would maybe be able to lead up the Department of Health and Human Services here in the United States and potentially get in there and make some sort of change. Do you know? I mean, I don't know what kind of conversations you've had with him about it, but or if you've given him some ideas. But do you what kind of change could be done on in a government level? If he were to be installed,
Yeah,
let's say, what
yeah.
changes could be made that would actually start unraveling this system?
Well, two things I've discussed with Bobby, and I've spoken to him, a number of occasions, and we've spoken even in an event in San Francisco last year together. And of course, he's in the film. Is that, as I mentioned earlier, I think one clear low-hanging fruit that everybody could get behind, politically, and members of the public definitely, is knowing what Big Pharma have been doing for so long. They should no longer, all of their data needs to be independently evaluated, right? And I think that's that from the roots, we would then get more reliable information on benefits of harms of all medications, right? And even cover all these other controversial areas like, traditional vaccines. We obviously, you and I know how bad the COVID vaccines. We'll get better information on all drugs. I think the other thing is sanctions. One of the things Bobby has mentioned is that when these crimes have been committed by these big pharma, whether it's Merck with Vioxx or other drugs over the last few decades, no one has gone to jail, right? People have got promoted.
Hmm.
One of the people involved in the opioid crisis, who advised the Sackler family on how to get more Americans taking opioids, he didn't go to jail. He went to Harvard Business School. So I think there needs to be tougher sanctions, and Bobby has said that he will introduce those sorts of sanctions as making a very strong point and sending a message and a deterrent that you cannot even. This is no longer going to be the cost of business. If you are found that you covered up data on harms, then you will go to jail, and that means senior executives. It means CEOs of big pharma companies. That's what needs to happen. And to be honest, Kim, I think it's overdue. Right. As
Hmm.
far as I'm concerned, the evidence is very clear on the COVID vaccine issue as well. Knowing from going back to square one, it is, and all the evidence we have right now, it has likely been responsible for millions of either deaths or serious harm around the world. Right. Millions.
Right.
And my overall opinion, and we can't be sure about this, is I think even if they didn't know at the beginning, as soon as they did know, they doubled down, and that's when they started introducing mandates. So at some point, they knew that it was causing serious harm, and they didn't stop the drug, they didn't suspend it, they didn't pull it, and that's because the law allows them to carry on doing this sort of stuff. And of course, they capture politicians. But I also think most members of Congress, most policymakers, most doctors don't know this stuff, Kim. If they even sat down and they can go with a critical eye and spent, an hour and 50 minutes to watch this film, I think they will not be able to unsee it. And I think their internal conscience will not allow them to continue in the same way. Elon Musk, he mentioned last year, before we started making film, we said, we need a film that really incorporates and encapsulates the big food, big pharma problem. We need a documentary on this. Who's going to do it? Well, we've done that documentary.
Yeah.
Elon, if you're listening, if you're watching this, please see it. And that will give you the sort of tools that you need to try and push this agenda of solving the panic of chronic disease. A lot of people are speaking out now, Kim, about this problem. It's a huge issue in America. Of course, Bobby's one of the leading figures, but there are many other people out there. And that's what we need to do next. Just spread the
Right.
information and get everybody just talking about it.
Yeah.
The good news,
Everybody.
Kim, by the way, as
Yeah.
well, just to add to this, is that solving this pandemic will theoretically not take a long time. I have patients that within weeks, in a similar situation, they've got obesity issues, they've got high blood pressure, type 2 diabetes, within weeks of purely changing their lifestyle from specific advice around diet, come off their pills, send a lot of their conditions into remission within weeks. Think about that happening on a population level. With the
Hmm.
right policies in place and the right training of doctors, you could solve this pandemic of chronic disease and reverse it significantly in one electoral term.
Yeah, I mean, it seems like it would be pretty much overnight. Things could be fixed if there was an actual, well, like for example, if they were to say, look, pharmaceutical heads, your head is on the chopping block for real. Like you're going to be prosecuted. You're going to be put in jail. You're going to be held accountable if you knowingly put drugs out there that you have not fully studied, or you're fudging the studies, or you're fraudulent in some way. Maybe actually holding them accountable. Here we are, we pride ourselves on being a law and order society, and yet there's so much crime that happens and people aren't held accountable. And one of them is big pharmaceutical companies are getting away with murder, with literal murder. I think that would do a lot, but I agree that I think an independent research body would, but who would pay for that? I think that's the big question. And that's the issue with the FDA and how Reagan was able to say, well, they got to, the users got to start paying for it, meaning the pharmaceutical
Yeah.
company, and that caused
So
corruption.
yeah. So Kim, I will tell you, we do have the money. We absolutely do have the money. It's just in the wrong place. A lot of these big corporations also, we've got $1 trillion in tax havens. And it's not that I've got nothing against the so-called free market or people making money doing the right thing. Free market principles, the brainchild was Adam Smith, 1776. He said, markets function best on perfect information and relative equality. We have the opposite right now.
Yeah.
So we have them. These people have made money from deception. They're not paying their taxes. Therefore, they say there's no government funding. We need to. This is nonsense. It's an absolute nonsense. We could very quickly create a situation where there is enough money that's publicly funded for the interests of the public, but we also need government that are trusted, are in those positions because they're generally putting public good first, not interests of big corporations. So we need the right people. We need the right values. There's a whole cultural shift that needs to happen as well, right? Part of the reason we've got to this situation also is because we have placed materialism ahead of our interaction with each other about basic values of honesty, integrity, kindness, putting the community first, that kind of thing. So there needs to be a cultural shift as well. And what's happened is we've now corporatized human beings.
Mm-hmm. One thing that you also bring up in the film is how to get healthy, how people can, heart disease is the leading cause of death, and how people can, rather than dosing up on a bunch of drugs, just like I mentioned it last time when my dad takes statins, and I asked him, Dad, why do you take statins? And he said, for my doctor. That was his answer, for my doctor. And that's kind of how he feels about a lot of his drugs. He's like, I don't think I need this, but the doctor wants me to take it, so I'm taking it for my doctor, so they don't get mad at me when I see them. Um, but you do give some pointers on what people can do. And one thing that you said in the film was that a lot of people when they think, oh, in order to get healthy, I've got to exercise. I got to do all this exercise. I don't have time to exercise, and that I'm supposed to be exercising. And one thing that was so interesting was so everybody should just watch the film because it's 2 hours of just tons of information. But one thing that really was interesting to me was that you could take two diets, one of them being, and they have the same profiles, the same protein, carbs, fats
Yeah.
profiles, but one is ultra processed and one of
Yes.
them is clean. And even
Real
if they
food.
have the same, right, real food, and the other one is ultra processed food, and even though they have the same, like, oh, I'm getting the right amount of protein, I'm getting the right amount of carbs, I'm getting the right amount of fat,
Yeah.
you end up still with a very different health outcome.
Yes, absolutely. It's very interesting. So that was actually a short sort of randomized trial where all the patient participants were same matched, for example. And the people eating ultra processed food actually ate 500 calories more per day and gained weight over 2 weeks versus the ones that ate real food. And just again, a very simple rule of thumb, I tell my patients, what is ultra processed food? If it comes out of a package, if it's packaged and you can count 5 or more ingredients, usually with additives and preservatives, it's ultra processed and best avoided.
Mm,
But unfortunately, Kim, that's 67% of the calories consumed by the average American right now.
yeah.
And those foods have been deliberately designed and manipulated to get you hooked and get you, to some degree habituated or addicted. And that's why people keep consuming. So with my own patients, when I say you cut out the ultra processed food, you cut out the sugar, and certainly for a period of time, you also remove all the refined carbohydrates from your diet for several weeks, without counting calories. Quite often, more often than not, they improve massively within just a few weeks in terms of
Yeah.
their health markers, and they lose weight as well.
So it just seems like diet is really kind of the key. The key is if people eat better, they don't even have to exercise, it seems like. And that might be good
No,
news for a lot of people. Like you don't have to exercise. I mean, you should go on
no,
a
you
walk
don't.
every day. It's good for you to walk,
Absolutely.
but you don't have to exercise and you can actually reverse a lot of your chronic diseases. You just have to eat differently.
100%. The only medical intervention that's been shown to reverse these chronic diseases on its own, the only lifestyle intervention, sorry, is diet on its own. the other interesting thing that comes out in the film as well, which was pretty extraordinary for me to see, and pioneering my own interest in cardiology research, is that heart disease actually can be reversed. The blockages themselves can be reversed. And of course, I went to India, and I won't spoil it for you, but for the people, they need to watch it. But
Yeah.
there's a special secret, a missing secret ingredient to actually reversing blockages of heart disease, which we bring out in the movie as well.
Yeah, it is really great. People should watch it. For one, what you're going to learn, what I learned anyway, was I knew about the issue with big pharma. Many of us, but a lot of people don't know about this. If I send this video, which I will, to my sister, for example, or to other family members and friends, and say, "Hey, you got to watch this," they'll learn everything. I don't think they know any. They might know from some things they've heard that yes, there's corruption with pharma. Big pharmaceutical companies are out there for money, and that's what they're mainly for. But they're going to learn so much more of the corruption from start to finish, from the medical journals, the FDA, the doctors themselves, and a lot of it's ignorance. I do believe a lot of it's ignorance, but a lot of it is
Yeah,
also nefarious, probably as well, or just greed. Greed is a big
yeah,
one. Um,
absolutely.
but then also what I like about the film is you do break down also how people can cure themselves, or not necessarily cure, but like really improve on their own. And these are things that are free, that we can do without having to pump ourselves full of pills. And I know my family has unfortunately, we have a huge history of heart disease. I have a cardiologist. Cardiologist wants to start cutting me open and inserting devices into me, asking, that's what they wanted to do to me. I've said no to it at this point, but they want to stick a device in me to monitor my heart, like um, something that's going to just watch it for 5 years, I guess. It's not a pacemaker, but it's kind of like that. And I'm like, I don't know. I don't know if I want to go down that road, or if I just want to focus on living a healthy life and trying my best to fend off heart disease that I'm probably a sitting duck for, just from being just family. But I think so many people are going to learn so much from watching this. I do have the link down below for where people can watch it. Everybody should watch it. It'll scare you, but it's a good scare, and you do teach a lot, so people will learn how to get healthy as well. So I thank you
Absolutely.
so
Yeah, thank
much.
you.
And you're right now in Austin. You're doing a premiere there. I mean, are people able to go and
Yeah.
watch this film? You said that there's premieres going on around the country that people can go and actually watch.
Yeah, at the moment we're just doing private screenings,
Oh,
but
okay,
people obviously
okay.
can download it. But yeah, we've got a screening today with Callie Means, and I think Bobby's chief of staff is coming, Del
Oh,
Bigtree.
good.
We've got Joseph Freeman, who was the lead author on the Pfizer and Moderna reanalysis paper as well. So we're having a panel discussion as well after that. So it'll be interesting to see how people react. But I think what's promising for me, Kim, we had a screening at a medical conference that I spoke at a few days ago in Washington D.C., and it was the first time we put it in front of healthcare professionals. And the response was just was amazing. It was extraordinary. I didn't expect it to be that strong. A lot of doctors were gobsmacked, but it resonated with them, and they want to just share it with their colleagues. And they're saying, we didn't realize the situation was so bad. So every demographic of people that have seen it so far, it's definitely impacting upon them.
I almost want to say to my doctor, you can't be my doctor unless you're going to watch this. If you're not going to watch this film, I'm going to a different doctor.
You should.
All right. Well, best of luck on this film. Again, that link is down below for everybody to watch it. I do really think everybody should. It's eye-opening. Share it with everybody. Dr. Asim Malhotra, thank you so much for being here. Really appreciate your time.
Thank you, Kim.
Thank you so much for watching. This was just a clip from the longer, larger show that you can catch Monday through Friday, 5 p.m. Pacific, 8 p.m. Eastern, at KimIversonShow.com. That'll route you to the platform where you need to be in order to get the full uncensored show every Monday through Friday, 5 p.m. Pacific, 8 p.m. Eastern. Click on that link, watch the full interview. See you there.